Hello to everyone from Geneva, from WHO headquarters. Welcome to this regular COVID-19 press briefing. Welcome to everyone who is watching us on a number of WHO platforms. There's more than 400 journalists watching us on Zoom as well, with a number of questions waiting for our guest today. And today we have a special guest. That's Kristalina Georgieva, the Managing Director of the International Monetary Fund. She will join this briefing to update about the economic impact of the COVID-19 pandemic and the response of the International Monetary Fund. For journalists who are online and wish to ask questions, please click raise hand. We will start with Dr. Tedros, who is joined by Dr. Maria Van Kerkhove and Dr. Mike Ryan. Dr. Tedros, please.
Thank you, Tariq. And good morning, good afternoon, and good evening. As Tariq said, we're delighted to be joined today by Kristalina Georgieva, the Managing Director of the International Monetary Fund. Welcome, my sister. Kristalina will say more in a few minutes about the economic impact of the pandemic and what the IMF is doing to support countries and the global economy. More than 1 million confirmed cases of COVID-19 have now been reported to WHO, including more than 50,000 deaths. But we know that this is much more than a health crisis. We're all aware of the profound social and economic consequences of the pandemic. The restrictions many countries have put in place to protect health are taking a heavy toll on the income of individuals and families and the economies of communities and nations. We're in a shared struggle to protect both lives and livelihoods. In the short term, countries can ease the burden on their populations through social welfare programs to ensure people have food and other life essentials. For some countries, debt relief is essential to enable them to take care of their people and avoid economic collapse. This is an area of cooperation between WHO, the IMF, and the World Bank. But ultimately, the best way for countries to end restrictions and ease their economic effects is to attack the virus with the aggressive and comprehensive package of measures that we have spoken about many times before: find, test, isolate, and treat every case, and trace every contact. If countries rush to lift restrictions too quickly, the virus could resurge, and the economic impact could be even more severe and prolonged. Financing the health response is therefore an essential investment, not just in saving lives, but in the longer-term social and economic recovery. There are three main areas for countries to focus on. First, we call on all countries to ensure core public health measures are fully funded, including case finding, testing, contact tracing, collecting data, and communication and information campaigns. Second, we also call on countries and partners to strengthen the foundations of health systems. That means health workers must be paid their salaries, and health facilities need a reliable supply of funding to purchase essential medical supplies. Third, we call on all countries to remove financial barriers to care. If people delay or forgo care because they can't afford it, they not only harm themselves, they make the pandemic harder to control and put society at risk. Several countries are suspending user fees and providing free testing and care for COVID-19, regardless of a person's insurance, citizenship, or residence status. We encourage these measures. This is an unprecedented crisis which demands an unprecedented response. Suspending user fees should be supported with measures to compensate providers for the loss of revenues. Government should also consider using cash transfers to the most vulnerable households to overcome barriers to access. This may be particularly important for refugees, internally displaced persons, migrants, and the homeless. The pandemic is also having an effect on the fight against other diseases like polio. As you know, in recent years, we have driven polio to the brink of eradication. This has been a massive global effort, started by Rotary, supported by many other partners, and led by thousands of health workers, vaccinating children in some very difficult and dangerous areas. Many of those health workers are now supporting the COVID-19 response. They're tracing contacts, finding cases, and providing public health information to communities. To reduce the risk of increasing transmission of COVID-19, the Polio Oversight Board has made the hard decision to suspend house-to-house vaccination campaigns, knowing that this may lead to an increase in polio cases. To reduce this risk, we will support countries to maintain essential immunization for all vaccine-preventable diseases. WHO has published guidance for countries on how to maintain essential health services even while responding to this crisis. The Global Polio Eradication Initiative is working to ensure that once it's safe to do so, countries can be supported to rapidly restart polio vaccination campaigns. While all our energy may be focused on COVID-19 now, our commitment to eradicating polio is unshakable. Sadly, there are reports from some countries of an increase in domestic violence since the COVID-19 outbreak began. As people are asked to stay at home, the risk of intimate partner violence is likely to increase. Women in abusive relationships are more likely to be exposed to violence, as are their children, as family members spend more time in close contact and families cope with additional stress and potential economic or job losses. Women may have less contact with family and friends who may provide support and protection from violence. We call on countries to include services for addressing domestic violence as an essential service that must continue during the COVID-19 response. If you're experiencing or at risk of domestic violence, speak to supportive family and friends. Seek support from a hotline or seek out local services for survivors. Make a plan to protect yourself and your children any way you can. This could include having a neighbor, friend, relative, or shelter identified to go to should you need to leave the house immediately. There is never any excuse for violence. We abhor all violence of all forms at all times. Finally, the global response to COVID-19 would not be possible without the generosity of countries and partners. 2 months ago, WHO issued its strategic preparedness and response plan with an initial ask of $675 million to support the response. I'm delighted to say that almost $690 million has now been pledged or received. Of this amount, $300 million has been given to support WHO's work, and the rest has been given on a bilateral basis or to other organizations involved in the response. I would like to thank the state of Kuwait, which today is becoming one of the largest donors with a total of $60 million US. Separately, WHO Solidarity Response Fund has now raised more than $127 million US from more than 219,000 individuals and organizations. I would like to thank Tencent for its contribution of 10 million US dollars. I'm also pleased to announce that I have invited UNICEF to join the Solidarity Response Fund. UNICEF has extensive experience both in fundraising and implementing programs, and our partnership will help us to work together closely to save lives. And thank you so much, my sister Henrietta, for accepting my invitation. We still have a long way to go in this fight. WHO is working every single day with all countries and partners to save lives and to mitigate the social and economic impact of the pandemic. The IMF is a key partner, and I would now like to hand the floor to my sister, Kristalina, to make a few remarks. And thank you so much for joining us, Kristalina. Thank you.
Thank you very much, Dr. Tedros, for the invitation, but most importantly, for the work you and your staff do. And I want to express from the bottom of my heart a gratitude to all health workers that are on the front line to save lives, sometimes risking their own. At the outset, I would like to make 3 points. First, this is a crisis like no other. Never in the history of the IMF we have witnessed the world economy coming to a standstill. We are now in recession. It is way worse than the global financial crisis. And it is a crisis that requires all of us to come together. WHO is there to protect the health of people. The IMF is there to protect the health of the world economy. They both are under siege, and only united we can do our duties. I want to stress the message that you and I have sent to the world, that saving lives and protective livelihoods ought to go hand in hand. We cannot do one without the other. And in that spirit, we at the IMF are concentrated on making sure that there is a strong response to the health crisis, as well as protecting the strength of the economy. My second point is about emerging markets and developing economies. They are hard hit, and they have very often less resources to protect themselves against this dual crisis, health and economic crisis. We know that in many countries, health systems are weak. We know that in flight to safety, a lot of capital has left the emerging economies, the developing world. Nearly $90 billion have flown out. This is way more than during the global financial crisis. And some countries are highly dependent on commodity exports. With prices collapsing, they're hit yet again. It is paramount for us to place these countries, and especially the weakest among them, in the center of our attention. The same way the virus hits vulnerable people with medical preconditions hardest, the economic crisis hits vulnerable economies the hardest. And that takes me to my third point. We at the IMF are mobilizing strongly, working together with the World Bank and other international financial institutions, bringing the world together to provide protection against this crisis. We have $1 trillion war chest, and we are determined to use as much as necessary in that protecting the economy from the scarring of this crisis. We are mobilizing emergency financing assistance to countries, and I can tell you we have never seen ever such a growing demand for emergency financing. Already over 90 countries have been placing requests to the IMF for it. And this emergency financing is to underpin the appeal that you and I are putting out. And it is, please prioritize health expenditures, use money to pay doctors and nurses, make sure hospitals function, that there are makeshift clinics where necessary, and protect your economy, the most vulnerable people, firms, so they can hold on their workers, because the highest risk we see is a wave of bankruptcies and layoffs that would make the recovery from this crisis harder. Third, we, in this line of financial support, we have the big one, 1 trillion, we have the emergency financing. We are also taking strong action for the poorest of our members by mobilizing grant funds to serve their duties to the IMF, so they don't have to use scarce resources today for that purpose. And together with the president of the World Bank, we put out an appeal to official bilateral creditors for the time the economy is standing still to have debt service obligations also in standstill, a moratorium on debt service for either countries. Let me finish by saying that this is, in my lifetime, humanity's darkest hour, a big threat to the whole world. And it requires from us to stand tall, be united, and protect the most vulnerable of our fellow citizens on this planet. Thank you. Thank you, Tedros, for having me.
Thank you very much, Ms. Georgieva, for this very remarkable speech. Thank you, Dr. Tedros. We will now open the floor to questions. I would ask journalists to ask only one question, and if it's possible to specify